Question 1. A nurse is assessing a patient's surgical incision and notes serosanguineous drainage. Which interpretation is most appropriate? A. It indicates early infection. B. It is a normal finding in the healing process. C. It signifies necrotic tissue breakdown. D. It reflects inadequate wound perfusion. Answer. B. It is a normal finding in the healing process. Rationale: serosanguineous drainage, which is a pale red or pink fluid, is common during the early stages of wound healing. It results from capillary damage and tissue repair. Option A is incorrect because infection usually presents with purulent drainage. Option C is incorrect because necrotic breakdown produces brown or black slough. Option D is incorrect because poor perfusion would result in delayed healing, not serosanguineous fluid. Question 2. A patient with a stage 3 pressure injury has slough in the wound bed. What is the nurse's best action? A. Apply a dry sterile dressing. B. Irrigate the wound with normal saline and notify the provider. C. Leave the slough intact to protect granulation tissue. D. Apply a transparent film dressing. Answer. B. Irrigate the wound with normal saline and notify the provider. Rationale: slough indicates non-viable tissue requiring removal for proper healing. Irrigation with saline helps loosen debris, and the provider may order debridement. Option A is incorrect because dry dressings adhere to tissue. Option C is incorrect since slough impedes healing. Option D is for superficial wounds, not stage 3 ulcers. Question 3. During a dressing change, the nurse notes foul odor and green drainage from a wound. What should the nurse do first? A. Document findings in the patient chart. B. Clean the wound with antiseptic solution. C. Notify the healthcare provider of potential infection. D. Cover the wound with a new sterile dressing. Answer. C. Notify the healthcare provider of potential infection. Rationale: a foul odor and green drainage suggests Pseudomonas infection, requiring provider notification for wound culture and antibiotic therapy. Option A delays intervention. Option B may destroy healthy tissue. Option D covers the infection without addressing the cause. Question 4. A nurse is caring for a diabetic patient with a non-healing foot ulcer. Which intervention promotes healing? A. Applying povidone iodine daily. B. Maintaining strict blood glucose control. C. Keeping the wound open to air. D. Changing dressings only once daily. Answer. B. Maintaining strict blood glucose control. Rationale: hyperglycemia delays healing and increases infection risk. Controlling blood glucose improves immune function and tissue repair. Option A is cytotoxic to healing tissue. Option C dries the wound bed. Option D may allow moisture imbalance. Question 5. Which nursing action demonstrates correct sterile technique during a wound dressing change? A. Opening sterile supplies with wet gloves. B. Touching the wound with clean gloved hands. C. Keeping sterile gloves above waist level. D. Pouring solution directly over the sterile field. Answer. C. Keeping sterile gloves above waist level. Rationale: maintaining hands above waist prevents contamination. Options A and B break sterility, and Option D risks splash contamination. Question 6. A nurse observes exposed subcutaneous tissue in a pressure injury, but no bone or tendon. How should the wound be staged? A. Stage 2. B. Stage 3. C. Stage 4. D. Unstageable. Answer. B. Stage 3. Rationale: Stage 3 pressure injuries involve full-thickness tissue loss with visible fat, but no bone or tendon. Stage 2 is partial thickness. Stage 4 involves bone or tendon. and unstitchable wounds have eschar or slough obscuring the depth. Question 7. A patient with a surgical wound states, "It suddenly opened, and I see something pink inside." What should the nurse do first? A. Cover the wound with a sterile saline moistened dressing. B. Apply firm pressure to the wound. C. Notify housekeeping for cleanup. D. Remove visible tissue and redress. Answer. A. Cover the wound with a sterile saline moistened dressing. Rationale. This describes wound dehiscence with evisceration, a medical emergency. The nurse should cover the wound with moist sterile dressings to prevent tissue drying and notify the surgeon immediately. Applying pressure or removing tissue is contraindicated. Question 8. When documenting wound assessment, which finding requires immediate reporting? A. Small amount of serous drainage. B. Slight redness around wound edges. C. Sudden increase in wound size. D. Mild tenderness during dressing change. Answer. C. Sudden increase in wound size. Rationale. A sudden increase in wound size may indicate dehiscence or infection. Options A, B, and D are normal or expected healing responses unless they worsen. Question 9. A nurse is teaching a patient about home wound care. Which statement indicates correct understanding? A. I will clean the wound with hydrogen peroxide every day. B. I'll wash my hands before and after dressing changes. C. I will reuse my dressings if they are not soiled. D. I'll cover the wound tightly with tape to seal it. Answer. B. I'll wash my hands before and after dressing changes. Rationale. Hand hygiene is the most critical step to prevent infection. Hydrogen peroxide is cytotoxic, reusing dressings is unsafe, and tight tape prevents air circulation. Question 10. A nurse notes black eschar covering a heel wound. What is the most appropriate nursing action? A. Remove the eschar with sterile forceps. B. Apply a hydrocolloid dressing. C. Leave the eschar intact and monitor for infection. D. Irrigate vigorously with sterile saline. Answer. C. Leave the eschar intact and monitor for infection. Rationale. Stable, dry eschar on the heel acts as a natural barrier and should not be removed unless infection develops. Debridement A or D can harm viable tissue. Hydrocolloid dressings B. Trap moisture and may macerate tissue. Question 11. A nurse is assessing a patient's wound and notes tunneling at the 3 o'clock position. What should the nurse do first? A. Pack the tunnel with dry gauze. B. Measure and document the depth and direction. C. Apply a transparent film dressing. D. Flush the wound with hydrogen peroxide. Answer. B. Measure and document the depth and direction. Rationale. Accurate measurement and documentation are essential for tracking healing and guiding treatment. Packing or cleansing comes after assessment. Hydrogen peroxide is cytotoxic. Transparent film is not appropriate for deep wounds. Question 12. A nurse caring for a patient with a negative pressure wound therapy (NPWT) device observes loss of suction. What is the nurse's first action? A. Replace the wound dressing. B. Reinforce the drape seal to restore suction. C. Increase the suction setting. D. Turn off the device. Answer. B. Reinforce the drape seal to restore suction. Rationale. A leak in the seal is the most common cause of suction loss. Restoring the seal maintains therapy continuity. Increasing suction or replacing dressing is unnecessary initially. Turning off the device interrupts sealing. Question 13. During wound irrigation, the patient reports severe pain. What should the nurse do? A. Stop the irrigation and assess the wound. B. Continue irrigation to remove debris. C. Use higher pressure to flush bacteria. D. Apply ice after irrigation. Answer. A. Stop the irrigation and assess the wound. Rationale. Pain indicates tissue trauma or infection. Stopping to assess prevents further damage. Continuing or increasing pressure worsens injury. Ice may reduce perfusion. Question 14. Which dressing type maintains a moist environment and is best for autolytic debridement? A. Gauze dressing. B. Hydrocolloid dressing. C. Dry sterile dressing. D. Telfa pad. Answer. B. Hydrocolloid dressing. Rationale. Hydrocolloid dressings maintain moisture, promoting autolytic debridement and faster healing. Gauze and dry dressings dry out tissue. Telfa is non-adherent but not debriding. Question 15. A patient with a draining wound has a wound culture ordered. What is the correct technique? A. Swab purulent drainage. B. Swab viable tissue after cleaning the wound. C. Collect old dressing for culture. D. Swab the wound edge. Answer. B. Swab viable tissue after cleaning the wound. Rationale. Cleansing removes surface contaminants, and viable tissue provides accurate bacterial sampling. Swabbing drainage or edges may yield false results. Question 16. A nurse identifies erythema and warmth around a wound incision. What should the nurse suspect? A. Inflammation from healing. B. Impending infection. C. Allergic reaction to dressing. D. Tissue necrosis. Answer. B. Impending infection. Rationale. Localized redness and warmth suggest early infection. Healing inflammation is mild and transient. Necrosis and allergy typically involve different presentations. Question 17. A postoperative patient's wound edges are approximated with no drainage. Which phase of healing is occurring? A. Hemostasis phase. B. Inflammatory phase. C. Proliferative phase. D. Maturation phase. Answer. C. Proliferative phase. Rationale. During the proliferative phase, granulation tissue forms and wound edges close. Hemostasis occurs immediately after injury. Maturation involves scar formation. Question 18. A nurse observes a pressure ulcer over the coccyx with intact skin but non-blanchable redness. How should it be staged? A. Stage I. B. Stage 2. C. Stage 3. D. Stage 4. Answer. A. Stage I. Rationale. Non-blanchable erythema of intact skin is stage I. Stage 2 involves partial skin loss. Stage 3 full thickness. And stage 4 deep tissue exposure. Question 19. A nurse is teaching a patient about preventing pressure injuries. Which statement shows understanding? A. I will reposition myself every 2 hours. B. I'll use a heating pad under my back. C. I'll keep my heels pressed against the bed. D. I'll drink less water to reduce swelling. Answer. A. I will reposition myself every 2 hours. Rationale. Frequent repositioning reduces pressure and improves circulation. Heat can burn, heel pressure causes ulcers, and dehydration impairs healing. Question 20. A nurse caring for a patient with a chronic venous ulcer should encourage which action? A. Keep the leg dependent. B. Elevate legs above heart level. C. Apply heat compresses daily. D. Massage the ulcer margins. Answer. B. Elevate legs above heart level. Rationale. Elevating legs improves venous return and reduces edema, aiding healing. Dependency worsens swelling. Heat increases inflammation, and massage risks tissue damage. Question 21. During wound care, the nurse finds the wound bed dry with delayed granulation. What is the priority intervention? A. Increase dressing change frequency. B. Use a moisture-retentive dressing. C. Leave the wound open to air. D. Apply hydrogen peroxide. Answer. B. Use a moisture-retentive dressing. Rationale. Moist environments promote cell growth and angiogenesis. Frequent changes and peroxide delay healing. Open air wounds dry out tissue. Question 22. A nurse is assessing a burn wound that appears red, moist, and blistered. What depth is this burn? A. Superficial. B. Partial thickness. C. Full thickness. D. Deep tissue. Answer: B. Partial thickness. Rationale: partial thickness burns damage the dermis, presenting with blisters and moist surfaces. Superficial burns affect only the epidermis. Full thickness burns are dry and leathery. Question 23. Which laboratory result best reflects effective wound healing? A. Hemoglobin 8.0 gram per deciliter. B. Albumin 4.0 gram per deciliter. C. WBC 18,000 per cubic millimeter. D. Blood glucose 280 milligrams per deciliter. Answer: B. Albumin 4.0 gram per deciliter. Rationale: adequate protein, albumin, supports tissue repair. Low hemoglobin or high glucose delays healing. Elevated WBC indicates infection. Question 24. A wound culture reveals methicillin-resistant Staphylococcus aureus, MRSA. Which infection control measure is required? A. Airborne precautions. B. Contact precautions. C. Droplet precautions. D. Reverse isolation. Answer: B. Contact precautions. Rationale: MRSA spreads by direct contact. Gloves and gowns are essential. Airborne and droplet precautions are for respiratory pathogens. Reverse isolation is for immunocompromised patients. Question 25. A nurse is preparing to remove a wet-to-dry dressing. What is the correct technique? A. Moisten the dressing before removal. B. Pull the dressing off quickly. C. Remove the dressing dry to debride tissue. D. Leave the dressing in place for 48 hours. Answer: C. Remove the dressing dry to debride tissue. Rationale: wet-to-dry dressings mechanically debride necrotic tissue upon removal. Moistening defeats this purpose. Leaving it too long promotes infection. Question 26. A patient with a diabetic foot ulcer reports numbness in the feet. What should the nurse assess next? A. Capillary refill. B. Sensory perception and protective reflexes. C. Wound drainage amount. D. Pain level using numeric scale. Answer: B. Sensory perception and protective reflexes. Rationale: peripheral neuropathy is common in diabetes. Assessing sensation prevents further injury. Capillary refill and drainage are secondary assessments. Question 27. Which type of wound healing occurs when wound edges are not approximated and granulation tissue fills the gap? A. Primary intention. B. Secondary intention. C. Tertiary intention. D. Delayed closure. Answer: B. Secondary intention. Rationale: secondary intention healing occurs with open wounds that heal from the base upward through granulation. Primary intention involves closed surgical wounds. Tertiary involves delayed closure. Question 28. The nurse applies a wound vac and observes bright red bleeding in the tubing. What is the immediate action? A. Stop the device and notify the provider. B. Continue therapy and observe for 30 minutes. C. Lower suction pressure. D. Reinforce dressing seal. Answer: A. Stop the device and notify the provider. Rationale: active bleeding indicates vessel damage, requiring immediate cessation and medical evaluation. Continuing suction could worsen hemorrhage. Question 29. A patient with a pressure injury is prescribed collagenase ointment. What is the nurse's understanding of this medication? A. It prevents infection. B. It promotes enzymatic debridement. C. It increases moisture absorption. D. It forms a protective barrier. Answer. B. It promotes enzymatic debridement. Rationale. Collagenase breaks down necrotic tissue enzymatically without harming viable tissue. It does not disinfect or absorb moisture. Question 30. A nurse finds macerated skin around a wound dressing. What is the most likely cause? A. Overhydration from excessive moisture. B. Dehydration from dry environment. C. Allergic reaction to adhesive. D. Bacterial infection. Answer. A. Overhydration from excessive moisture. Rationale. Maceration results from prolonged moisture exposure, breaking down peri-wound skin. Dehydration causes dryness, and infection presents with erythema or exudate. Question 31. A patient with a large abdominal wound is on negative pressure wound therapy. The nurse notices a sudden drop in blood pressure and bright red drainage in the collection canister. What is the nurse's immediate priority? A. Stop the negative pressure device and apply pressure to the wound. B. Lower the suction pressure and continue monitoring. C. Document findings and notify wound care nurse. D. Replace the dressing with a dry sterile gauze. Answer. A. Stop the negative pressure device and apply pressure to the wound. Rationale. The patient is likely experiencing hemorrhage due to vessel erosion. Immediate actions are to stop therapy, apply pressure, and notify the provider. Options B, D. Delay life-saving interventions. Question 32. A nurse caring for a patient with a grafted burn wound notices pale, cool, and mottled graft tissue. Which interpretation is most accurate? A. Graft is well perfused. B. Graft perfusion is compromised. C. Infection is resolving. D. Normal post-graft appearance. Answer. B. Graft perfusion is compromised. Rationale. Pale, cool, and mottled tissue signals poor perfusion and possible graft failure. A healthy graft should appear pink and warm. Options A, C, and D are inaccurate interpretations. Question 33. A nurse notes a wound with thick, yellow slough and strong odor in a patient with diabetes. What is the nurse's most appropriate first action? A. Apply enzymatic debriding ointment. B. Obtain a wound culture before cleansing. C. Clean the wound thoroughly before culturing. D. Start prescribed antibiotic therapy. Answer. C. Clean the wound thoroughly before culturing. Rationale. Cleaning removes surface contaminants to ensure accurate culture results. Culturing before cleansing can produce false positives, and antibiotics should not start before culture confirmation. Question 34. A nurse assessing a pressure ulcer notes undermining from 12 to 3 o'clock. What is the best nursing action? A. Document the direction and depth accurately. B. Pack the undermined area tightly with gauze. C. Apply hydrocolloid dressing. D. Close the wound edges with tape. Answer. A. Document the direction and depth accurately. Rationale. Undermining must be precisely measured and documented using the clock method. Tight packing causes ischemia. Hydrocolloid and tape closure are inappropriate for undermined wounds. Question 35. A patient with a chronic arterial ulcer has severe pain in the lower leg that increases when elevated. What is the best nursing intervention? A. Keep the leg flat or dependent. B. Elevate the leg above heart level. C. Apply a compression bandage. D. Use a heating pad to improve circulation. Answer. A. Keep the leg flat or dependent. Rationale. Arterial ulcers require gravity-assisted perfusion. Elevation reduces blood flow and increases pain. Compression and heat are contraindicated due to ischemia. Question 36. A nurse notes necrotic black tissue on a diabetic foot wound with purulent drainage and foul odor. Which collaborative action is most critical? A. Notify the provider for surgical debridement evaluation. B. Continue daily saline irrigation. C. Apply a topical antibiotic. D. Cover with dry sterile gauze. Answer: A. Notify the provider for surgical debridement evaluation. Rationale: necrotic tissue with infection requires surgical sharp debridement for infection control and healing. Topical antibiotics or irrigation alone are insufficient. Question 37. A patient on corticosteroid therapy has a surgical incision that remains unhealed after 2 weeks. What is the nurse's best understanding of the cause? A. Corticosteroids delay collagen synthesis and immune response. B. The wound dressing was changed too often. C. Excess moisture caused maceration. D. The patient's protein intake is excessive. Answer: A. Corticosteroids delay collagen synthesis and immune response. Rationale: corticosteroids impair wound healing by reducing inflammation, fibroblast activity, and collagen deposition. Options B, D are less likely to explain delayed closure. Question 38. A nurse finds a deep wound with exposed tendon that emits a foul odor and has yellow-green exudate. The patient's temperature is 102 degrees Fahrenheit, 38.9 degrees Celsius. Which nursing diagnosis takes priority? A. Impaired skin integrity. B. Risk for infection. C. Infection related to open wound. D. Impaired tissue perfusion. Answer: C. Infection related to open wound. Rationale: the patient already has systemic and local infection evidence, odor, drainage, fever. Risk diagnoses are not appropriate once the problem exists. Question 39. The nurse is teaching a patient about wound healing. Which statement requires correction? A. I'll increase my protein and vitamin C intake. B. I'll stop smoking until my wound heals. C. I'll clean my wound daily with full-strength betadine. D. I'll keep the wound moist and covered. Answer: C. I'll clean my wound daily with full-strength betadine. Rationale: betadine damages granulation tissue and delays healing. Protein, vitamin C, smoking cessation, and moisture balance all promote recovery. Question 40. A patient with a stage 4 sacral ulcer is being discharged home. Which instruction is most essential for the home caregiver? A. Reposition the patient every 2 hours. B. Use alcohol wipes to keep the area dry. C. Apply pressure to the wound to promote circulation. D. Limit fluid intake to reduce drainage. Answer: A. Reposition the patient every 2 hours. Rationale: frequent repositioning prevents further tissue breakdown and promotes oxygenation. Alcohol dries and irritates skin. Pressure and fluid restriction worsen tissue perfusion. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.